For decades, Nigeria's HIV response has relied on the generous support of international donors, driving life-saving interventions and transforming countless lives. However, the reality of diminishing donor funding threatens to undermine the progress made. This reality set the stage for the Sustainability Sensitization Meeting with states, a gathering of relevant stakeholders from national and subnational government bodies, civil society, and development organizations. The meeting aimed to reshape Nigeria's HIV response and transition from dependence on external aid to a locally driven model that emphasizes accountability, innovation, and long-term planning. In her remarks, the Director General of the National Agency for the Control of AIDS, NACA, Dr. Temitope Ilori, highlighted the importance of a decentralized approach involving all levels of government stakeholders.
As we continue to count down to 2030 and to ensuring that HIV/AIDS is no longer a public health threat, we need to intensify our discussion and ensure that we have the necessary framework and blueprints to ensure that we take ownership of the HIV response. So you all stakeholders seated here today are actually the foot soldiers. You're actually the people that will drive this and actually make this come to bear at the state level, at the local government level, even the community level. That is why we've invited you here to have a discussion around this so that we can all brainstorm, we can all co-create, and also design the necessary blueprints and framework.
The meeting was characterized by robust discussions and active participation, as participants proposed a range of strategies and shared innovative ideas they believe will contribute to the national sustainability agenda.
We are all here at the discussion table at the level of development of this sustainability plan for a country. For states that develop their own, is also an opportunity for us during the review of implementation, how far we've gone as regards implementation of our own sustainability plan. Look at areas that we did not even think about in the first place, or look at future challenges that might be emanating, and harness all this from this new national document development and merge it to what we already have at the subnational level and ensure that we fight HIV to finish and achieve our targets by the year 2030.
Sustainability of the response is a new song, is a new, the new national anthem. And it's not only happening in Nigeria. The conversation is across nations. And they're talking about ownership. And if we're going to own it, a lot of things, we need to start discussing about a lot of things. The regulatory bodies have actually been saying that, okay, let them increase the quota for health workers due to this JAPA syndrome and all that. But the key people in the response are the treatment areas. They call them the mentor mothers. The HIV positive women, they pass through labor, they know what it takes, and they are very important in this response. But it's always difficult to employ them in the state civil service because there is no cadre for them. So let's see if they're important. What can we look at is think inside and bring out and see how state governments can actually employ them so that they can continue to do this job, so that we can continue to achieve more.
In the sustainability issue, a lot of hands has to be on deck. Now, I am proposing a basket of funding where the donor agencies will bring their fund. The federal government will contribute fund. The state government will contribute fund. The local government, especially now that they are autonomous, will also contribute fund to ensure that there is enough fund to manage the cases of HIV/AIDS. And now, an important agency that will also be involved is the health insurance. If we create enough fund for health insurance, we make sure that anybody that has HIV/AIDS will be managed free of charge. By so doing, the sustainability issue we are discussing today will be a thing of success.
The country director of UNAIDS commended NACA's leadership and reaffirmed the continued support of the UN system to Nigeria's HIV sustainability efforts.
It is important that we look at our programmatic sustainability, which is ensuring that, so government institutions, the communities are involved in implementation. But it's also important that we look at the financial sustainability. We cannot sustain a response if most of the funding are coming from donors countries. So that's why we are here. Charting the costs, taking in consideration the specificity of each state. That's something it is important, but not doing that in vacuum. Not doing that in vacuum, because the Federal Minister of Health, under the leadership of Professor Pate, so is steering a process, so where as part of the SWAP, so the entire activities, policies, and implementation, including HIV and AIDS, sort of have to be aligned, so with one plan, have to be aligned with one monitoring, have to be aligned, so with one budget, and also have to be aligned, so with one conversation. That's why we are here, and we really want to commend the leadership, so of NACA to lead us, so in that process.
The Sustainability Sensitization Meeting was a crucial step towards realizing Nigeria's vision of a domestically driven HIV response that ends AIDS as a public health threat. The National Agency for the Control of AIDS, NACA, recently held a press briefing to spotlight a groundbreaking 5-year study titled HIV Vaccine, Innovation, Science and Technology Acceleration in Africa, HIV-VISTA. Funded by the United States Agency for International Development, USAID, the initiative leverages local expertise and resources in Nigeria alongside 7 other African nations to advance HIV vaccine research and address the unique challenges faced by the region. The Director General of NACA commended the initiative and pledged the agency's support.
Like we always say, prevention is better than cure, but in this case, having a vaccine is a good step in terms of prevention. In Nigeria and across the African continent, we've had good reduction in new infections of HIV/AIDS. However, the epidemic still persists, and we think this vaccine trial is really a huge step in the area of prevention to ensure that we are able to, ensure that HIV/AIDS is no longer a public health threat by the year 2030 and beyond.
The Institute of Human Virology, Nigeria, has been designated as a sole site representing the West African sub-region.
HIV has affected Africa, sub-Saharan Africa, more than anywhere in the world. We still harbor 70% of the infection globally. So with this effort, and with the fact that we're working towards getting an effective vaccine, and if we get it, and we work with our communities and make sure that everybody gets the vaccine when it's available, then we have a hope of ending HIV. No longer would people be taking medication every single day. More importantly, we will not be getting more people infected by the virus. We will really have an end to the HIV epidemic after about 30 years, over 30 years of really dealing with this infection.
By harnessing the expertise of African scientists, the HIV-VISTA study seeks to drive innovation and make significant contributions to the global effort toward developing an effective Africa-led HIV vaccine.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng.